My name is Dr. Chiraag Kotecha and I'm the specialist at Refine Skin and Body Clinic located at Forest Mall and Lugogo Bypass. You can find us on 0758 232 889 or visit our website at www.refineskinandbody.com or look at the contact details down below. The first topic I'm going to talk about today is about dark knuckles. This is a common condition that I see a lot of in my clinic. Many patients present to me with dark knuckles and expanding onto that, dark elbows or dark knees. Now, there are many causes to these dark knuckles. Let's start with some of the most common that I see is usually due to lightening creams, and a bit more of that in a second. However, dark knuckles can be caused mainly due to sun exposure. Ultraviolet rays from the sun get absorbed by the melanocytes or the skin cells and give this dark pigmentation. Could be all over, but in particular on the knuckles. So protect your skin with sunscreen if you're out and about in the sun. If you're a farmer, spending a lot of time as a sportsman out in the sun, for example, and you don't want these discolorations, apply sunscreen on your body. Second thing, we see a lot of patients with eczema or psoriasis. These are medical conditions. If you have them, you'll know where there is either excessive dryness of the skin or excessive turnover of the skin, which leads to unusually dark knuckles, dark elbows, for example. Medical conditions such as diabetes can lead to a condition we call acanthosis nigricans, where somebody can have a velvety appearance on the back of the neck, sometimes on the elbows and knuckles. Now, these have medical background to them. Your blood sugar is uncontrolled, your diet is not good, for example, in diabetes. So this requires investigation by the doctor. If you have dark knuckles, it could be genetic also. Your parents, your siblings have it. Not much you can do about that. That is an inherited condition. So these are the common things. When you see somebody with dark knuckles, don't automatically assume they've been on lightening treatment, which is although very common in Uganda, there can be other causes for these dark knuckles, which we talked about: diabetes, psoriasis, eczema. We see a lot of people who work in the office who use their elbows on the table and rub them when they're working, when they're writing. That friction causes friction on the elbows, leading to dark elbows there. Again, patients have this, some people have a tendency of rubbing their knuckles, which leads to darkness on the knuckles due to the friction there, leading to excessive turnover. Now, those are the ones that we can see, we can talk about and try and manage them. Most untrained people would come and treat them with hydroquinone, which is, yes, it could be. Hydroquinone is a bleaching product we find quite commonly to help lighten up certain specific body parts. However, in Uganda, we have this tendency of these cosmetic products containing high concentrations of hydroquinone or mercury that can lead to skin lightening. So people like that. They want the skin to look lighter for some reason. They want to change the skin color, but it looks doesn't lighten the skin in a safe manner. What happens is they end up with patchy looking skin over the skin, especially on the knuckles, which remains dark. You can see somebody with very fair skin due to the lightening products, then they end up with dark knuckles, dark elbows. Now, this is where the lightening has been taken to an excessive or an overuse of the lightening creams, leading to those products. So if you have any of these problems that you need to be concerned about your dark knuckles, please do visit one of your doctors, your skin specialists. You can also come to see me at Refine Skin and Body Clinic at Forest Mall. When you come in, we'll go through a history of how long you've had this problem before, find out if your family, anybody in your family is affected, if there is a genetic predisposition or any family history of it. If you've been on any medication, sometimes some blood pressure medications, some medication we use for treatment of psychiatry can lead to this formation of dark knuckles as well as a side effect. So it's a comprehensive approach into how long you've had it, are you on any treatment for anything else, what precautions or what treatments you've had, whether you've been using sunscreen or sunblock, whether you have been using any lightening creams. Based on that, then we will start your treatment. On the topic of lightening creams, which is very common in Uganda, we see the dark knuckles will first stop you from using those lightening creams because you need to get the other skin to reverse back to its normal looking complexion. And patients say, I cannot be seen with my normal color. I need to continue the lightening creams. Well, in that case, I'm not able to help you. No doctor can help you to manage your dark knuckles if you're still going to continue using the skin lightening creams for your other body parts. That is something you'll have to understand, decide to stop those lightening creams, and then we can manage your skin lightening or brightening of your skin in a more safe approach without the use of these bleaching products, hydroquinone, and mercury. Now, this brings me on to my second topic, which we talk about. What are these bleaching products that are available in the market? We see a lot of these creams produced downtown that have hydroquinone at unsafe concentrations, 6%, 10%, combined with mercury. Mercury is an oncogen, pro-cancer product, which is now not safe. If you recall as children, especially in my age, we used to use these thermometers in the mouth, which used to have mercury to measure the temperature. That is now banned because mercury, if absorbed, can cause a lot of problems in the body, including cancer. Why is it fine then for people to mix this mercury in those lightening creams with the hydroquinone to make your skin brighter? It just doesn't make sense why you do that. Along with that, people combine steroids. Now, this combination cream of hydroquinone, mercury, steroid works very nice in the beginning for people to brighten and lighten the skin. They feel, oh, finally my skin is glowing. Finally, I'm lightening up. I have seen people within 3 weeks of using such lightening creams coming and presenting to me where their veins are now very sort of blue and appearing over the skin. With a bit more longer use, they end up with stretch marks on their body, whether it's under the arms, on the stomach, on the face. I've seen stuff such as what we call steroid acne. Some patients will go to the pharmacy, which is another problem we have here in Uganda, where you can turn up to the pharmacy and buy medication over the counter. This is not a good practice. The pharmacist is not trained as a doctor to be able to just give you medication to apply. Go see a doctor. Some of these creams that they might give you have steroids in them that help work very nicely to calm down your acne. And then you realize that you're reliant on it, that if you stop the steroid cream, you end up with acne. Similarly, in those lightening creams, long-term use of the steroids in the lightening creams lead to a condition called steroid acne, where you get a lot of acne on the face. No matter what treatment you use, it leads to that kind of the acne being persistent. So we need to get you off those creams. We need to stop the steroid cream, the lightening creams. A very, very severe condition we see due to lightening creams, especially hydroquinone, is something called ochronosis, where there's a kind of a grayish, bluish discoloration of the face. I've seen some ladies in the 50s, 60-year-old ladies who've been using lightening creams for many years and have been covering the face with makeup. Now they're like, oh, even the makeup doesn't seem to cover that pigmentation. So they come in and they want treatment done. How do we do it? We get them to stop their lightening creams for some time. We put them on some medication, either with glutathione, which is an antioxidant that helps DNA repair and helps recover and also helps lightening of the skin at high dose. But we use the glutathione. We can do something called mesotherapy, which are injections of some lightening agents into the knuckles we talked about, into pigmentation on the face. Or we can even use laser treatment. We have laser treatments at a Refined Skin and Body Clinic, such as this Q-switch laser or the picosecond laser. These are special lasers that can target the pigmentation. Similarly to when you have a tattoo and you want to get rid of the tattoo, which, by the way, we can do at Refined Skin and Body Clinic as well. You can come in and get those tattoos that you don't like taken off. But if you got that pigmentation that has come due to long-term use of lightening creams, we can come in and treat that with the lasers to help remove the pigmentation. Now, one thing which I tell, this is not magic. I'm not telling patients we're going to come in, we're going to treat you once and you're going to be flawless. It takes some time. You've damaged your skin because of lightening creams over months or years. Don't expect any doctor, any professional in the world to treat you in one go. It usually requires a series of treatments, a few treatments either spaced out every month or every week that can help to improve that pigmentation that you've got, that rebound pigmentation you've got because of those cheap fake cosmetics I say, that have hydroquinone, mercury or steroid in them, which have been mixed. You don't know what ingredients are in there. They're very common. So what you should remember, the bottom line, it may seem cheap in the beginning, It may work well in the beginning, but in the long term, it's damaging your skin. So it's better to go into a program which is safe, has been studied, has been recommended by dermatologists or skin doctors to improve the quality of your skin. Now, when I talk about hydroquinone, it's not all bad. Don't think hydroquinone is a bad product. We do use it as doctors, but in specific conditions, in specific places, for certain patches of treatment. I get patients coming in treatment for melasma, which is a discoloration on the face due to sun exposure or hormonal imbalance. I use hydroquinone there, plus other products. Now, they might say, but doctor, you said hydroquinone is bad. Yes, it's bad when used as a lightening agent head to toe. But if we use the hydroquinone in different concentrations for a specific period of time, 4 to 8 weeks, maximum 8 weeks on a specific location for lightening the skin, say on the cheeks, on the knuckles, where I talked about genetic conditions or medical conditions leading to darkening of the knuckles, I may recommend hydroquinone to you there for a short period of time to lighten it, provided you've not been using lightening creams for a long term head to toe. Then it is safe. We can use that. So don't be scared about it, but don't use it without any advice, without consulting your specialist, your dermatologist. We have several around Uganda. You can call them. If you have trouble finding one, you can come and see me, Dr. Chiraag Kotecha. You can come to Refine Skin and Body Clinic at Forest Mall or call us on 0758 232 889 or visit our website at www.refineskinandbody.com and we can help you for any of these skin problems you may have. Thank you.